Hi, today we'll be talking about dental hygiene in the U.S. and around the world.
I'm Rosa and I'll be talking about North Carolina.
I'm Heidi, I'll be talking about Germany.
And I'm Kristen and I'll be talking about Kentucky.
Hey Rosa, tell us about what supervision is required in North Carolina.
So direct or general supervision is required to perform prophylaxis, take x-rays, apply topical anesthesia, apply fluoride, take impressions, remove perio dressings, and remove sutures. And dental hygienists cannot administer local anesthesia or nitrous oxide. And they also can't place perio dressings or sealants. So it's a little bit more strict compared to the other states as far as what they can or can't perform.
What's required for licensure?
To obtain licensure in North Carolina, one must pass the National Board Dental Hygiene examination, and then one also has to pass the clinical examination, which in North Carolina they only have one that they accept, which is the CITA, and then you must have graduated from an accredited dental hygiene program as well.
What is the regulatory board in North Carolina?
The regulatory board is called the North Carolina State Board of Dental Examiners, and it consists of 6 dentists, 1 registered dental hygienist, and 1 public member.
What's the salary like in North Carolina?
The annual wage for North Carolina is $67,000, and then the hourly wage would be about $32.
So Kristen, you're going to tell us about Kentucky. What type of supervision is required in Kentucky?
Okay, so for direct supervision, which is when a dentist needs to be present, that's going to be for local anesthesia, nitrous oxide, as well as topical anesthesia. And then for general supervision, that's where a dentist authorizes the procedure but doesn't have to actually be there. That includes prophylaxis, x-rays, impressions, place as well as remove perio dressings, remove sutures, place sealants, root planing, as well as fluoride. And then direct access supervision, that contains prophylaxis, fluoride, sealants, and root planing.
What is required for licensure in Kentucky?
So it's kind of similar to other states. First, you have to have CPR in order to take the national board exam, which you have to pass. And then also you have to pass a clinical exam, and all of the exams are accepted. There's different ones that you can take, but Kentucky accepts all. And then also you have to graduate from a CODA accredited program.
What's the regulatory board?
The regulatory board is the Kentucky Board of Dentistry, and that's made up of 10 members. So you have 7 dentists, you have 2 registered dental hygienists, as well as 1 citizen who's a part of that.
And what is the salary in Kentucky for a dental hygienist?
So looking up, and this is like the mean wage for the dental hygienist in the state, the annual is $58,000 a year, and so that makes out about $28 per hour.
So does Germany have dental hygienists?
Dental hygienists are very rare in Germany. The professional title of dental hygienist is not protected in Germany as it is in many other countries, so anyone can market themselves as a dental hygienist. Dentists like this for financial reasons, and dentists are extremely opposed to dental hygienists gaining certification and licensing. As a result, the hygiene providers are doing an insufficient job at best, and many of them rarely work subgingivally. To an average German patient, dental hygiene looks professional, but if the patient were to research the quality of training and expertise that their hygienist has compared to in other nations, they would see that their care is lacking. Only about 3% of the money spent on dental care in Germany in the year 2014 was allocated to periodontal treatment, which was not indicative of the real amount of perio disease that they have in the country.
So are there any associations for hygienists to belong to?
There are a few different dental hygiene associations in Germany. The only one that is recognized by the International Federation of Dental Hygiene is called DDHV, or the German Diploma Dental Hygienists Association. Seems that in Europe, a diploma dental hygienist is the term that dental hygienists go by when they're official, when they're certified. There are about 150 dental hygienists in the DDHV, and all of them have completed their studies in other countries. So that entailed 3 years of education, taking a national exam, and then a registration in the country in which they're certified. So they're not registered in Germany because they don't have that set system yet, but they are registered in the country where they completed their education. Looks like that also includes an aptitude test, a clinical exam, and an oral exam. The information was kind of iffy on the internet because there were so many different ways that you could become a dental hygienist, either working chairside and just being trained by your dentist, or there were 3-month programs, 6-month programs, and also dentists themselves gave periodontal treatment to their patients as well. And the DDHV is also the regulatory board. They're working on putting together a bachelor's degree for Germany. They do urge Germans, though, in case you move to Germany and want to find a dental hygienist, find out where they were certified and where they got their training and education, because they may have no training at all. It was hard to narrow down what dental hygienists can do as far as local anesthesia and lasers, nitrous, but I got the impression that they must always be supervised by a dentist, no matter what they're doing. Radiographs are acceptable, and periodontal scaling is acceptable, but all under general supervision.
So you recently went to Germany, right?
Yes.
Is there anything interesting that you'd like to share?
Yes, I found something really interesting, and I thought about all y'all, my classmates, during that time. When we were filling up the car with gas, in the gas stations there were just, there was a full wall of cigarettes, and next to the Jägermeister and other things that for some reason were also sold in gas stations. And the cigarettes all had really graphic pictures on them, either a close-up of an intraoral lesion or someone laying in a hospital bed, or just these really graphic images. And it surprised me because smoking seemed really prevalent there still in the restaurants. Almost all the restaurants you were allowed to smoke outside, and in many of the restaurants you could smoke inside, and people seemed really healthy there, like really in shape. There was a lot of biking as opposed to driving cars. So I was surprised at the prevalence of smoking, given how healthy the Germans appeared to be, and also the pictures on the outside of the cigarette containers. It was pretty yucky.
Thanks for joining us today as we explore dental hygiene across the world.
Auf Wiedersehen.
Goodbye!